At Trilogy, we understand that families come first. We're proud that our residents and their families have chosen to allow us to care for them. We know that it's an emotional decision to place a loved one at our health campus. And we know that our job is not just to care for a single resident, but for an entire family.
When a family makes a decision to place a loved one, it's usually very traumatic for everybody involved. And it's our role to help people understand that where it may be their first experience, we are the experts in that area. When a resident comes to our campus, we should be prepared and let them know we were expecting them. And that's part of why we do the preparation of the room, is to let them know that we did know they were coming and we were ready. When we work with a resident, we also expand that to the family. And we've had celebrations where grandchildren are born. We've celebrated weddings in our courtyard. At times, the resident can't get to a particular family celebration. So if the resident can't make it to the celebration, we'll bring it to the campus. We set up a program so we proactively will call, not when there's a problem, but just to see how things are going. And that really creates a nice path for us to stay engaged.
When we got there, the staff, they just met us as if they'd known us forever. I think the director out there, she was always available. She would come around and make sure that everything was okay from time to time. And even the staff in the kitchen, they would just come around and ask if there's anything that you like in particular. We'd be glad to cook it for you. And they offered us meals to eat with her, especially those first few days, so we wouldn't have to feel like we were in a strange place.
Family members are an important part of our resident support network and our entire campus family as well. Family members are always welcome at our campuses and are involved in all decisions pertaining to their loved ones.
The staff, I have actually seen them tear up with us, because when you're with these people for such a long time and they loved her, what we didn't do to spoil her, they did. So it was kind of like that. And she knew it too. She had dementia, but she could still communicate very well, where some patients are really not able to. And then toward the end, the care that she got that last week when she had the stroke that eventually led to her death, it was like they were losing a member of their own family. And it wasn't phony, it was real. With my nursing background, it feels like to me that comes second nature, to want to treat people with respect. And they were like that. You can spot people from afar, and you know what kind of personality they have as far as their caring nature for other people. And somehow they just have a way to get those people out there. I really do believe they do.
From family nights to Sunday brunch, from regular communications to our Family Ambassador program, at Trilogy, caring is a family tradition.